All right, well, thank you all for being with us again today. Today's webinar for the 2020 Refugee Summit webinar series is focusing around what is telehealth. I know that a lot of our communities have seen the change where a lot of medical services have moved to the telehealth model. And so today we have Jacquie Easley and Dr. Joel Ward, both from Mercy One, here with us to explain a little bit about their services and about this transition. So instead of reading bios, I was hoping that we could have this themselves. And Jacquie, would you want to go ahead and start and just tell us a little bit about yourself?
Hello, Stephanie, are you still there? Because you kind of went, okay, but you can hear me. So hello, everyone. I am Jacquie Easley McGhee. I am Director of Health Equity at Mercy One, Health Equity, Community and Diversity Services. Some of you know me from my work in terms of providing language access services for our patient population here at Mercy. And in addition to that, and particularly this year, as we have been concerned about the disproportionate number of coronavirus patients from communities, from underserved communities, communities of color, Latinx community, African American community, and some from our refugee population. My focus has really steered towards health and equity impact. And so I'm working on several projects that will probably be launched here shortly about ways that we can, and one includes vaccinations, ways that we can eliminate some of those gaps that really, I often say the pandemic tore the Band-Aid off the long festering wounds of disproportionate health measure outcomes for some of our populations. That's an area that really focusing on. And really happy to be working somewhat with Dr. Ward, or assisting Dr. Ward as he serves those communities. And we're appreciative of his interest in making sure that language access is provided in our telehealth services. So Dr. Health, or Dr. Ward, Dr. Health, that's a good name for you. Dr. Ward, would you like to share a little bit about yourself?
Sure. Thank you, Jacquie, and thank you, Stephanie. I'm Dr. Ward. I went to Kansas City University for med school. I'm originally from Kansas City. Moved here to Des Moines to be with my wife's family. I've got 3 little girls that are the love of my life. We have a very rambunctious house. I've been working here at Des Moines for about 6 years, and I'm the chief medical informatics officer of the clinics and the hospital system. And so, what that means is I work in technology to try to make care as good as we possibly can and as easy as we possibly can for everybody.
Thank you, Dr. Ward. So I thought, for some of you know who Mercy is, but I thought I would just share a brief background about Mercy and why Dr. Ward and I are able to do the work that we do. So we've got a couple of slides to just give a brief overview. Okay, well, in case you're not aware, Mercy One is a not-for-profit Catholic healthcare provider. We have Mercy One main campus, or central campus as we call it, hospital, in addition to our site in West Des Moines, which is West Lakes, Mercy One Medical Center West Lakes, with a total of about 875 beds. We also, included in that, have the Mercy One Children's Hospital and Clinics, which is located mainly on our central campus site. And then recently we have acquired Mercy, and we also have a facility in Centerville, Iowa. And recently we have acquired the facility formerly known as Skiff in Newton, which is now Mercy One Medical Center, Newton. And central to the work that we do every day and our mission is the fact that we were founded by the Sisters of Mercy in 1893, which makes us really the longest continually operating hospital in Des Moines. Included among our associates are about 7,000 staff members. We have a medical staff of about 1,200 physicians and allied health professionals. And that, of course, makes us one of the state's largest employers with our various sites and the Midwest, one of the Midwest's largest referrals. We also, next slide, please, have association or affiliation, maybe is a better term, with Mercy College of Health Sciences, which is located here in Central City, Des Moines. And Mercy College really evolved from the Mercy School of Nursing, Radiology, and Emergency Medical Services in January 1994. And then it became Mercy College of Health Sciences in July 1995. The college's educational programs include a bachelor's degree in healthcare administration, health information management, and public health. And during the pandemic, the students, just like everyone else, had to pivot from, you know, a lot of the lab work that they were doing and on-site work. But I'm really pleased that they've been able to really do some community engagement. Most recently, we had an anonymous donor that gave us a donation to buy influenza vaccinations. And so the Mercy College students were really the ones who were able to, what I call, provide the on-site street kind of influenza clinics, pop-up clinics, so to speak, that we did in the last 2 to 3 weeks. And so we have been able to provide free flu vaccinations. And Stephanie, thank you for your help in advertising them on the ROSI website. We have noticed a fairly significant number of some of the individuals who receive those services were from the refugee and immigrant communities. So we want to thank you for providing that information. And then finally, the college was really instrumental several years ago in providing opportunities for first generation immigrants to matriculate at the school through a grant that they received. And they call that program Pathways to Healthcare Careers. And as you can see, about more than 180 refugee and immigrant students were able to complete coursework as a result of that program. And that's one initiative that I am currently working on now, is to revitalize those efforts, because we feel that the pipeline, the increase in the number of diverse folks in our healthcare pipeline will potentially help us with some of those health measure outcome gaps that I mentioned earlier. So I want to share a little bit about the mission, because it does relate to the work that Dr. Ward does and some of the other work that we have done in the last few months related to the pandemic. And next slide, please. We have a basic philosophy here at Mercy, which we call our cultural humility. And it is really valuing diversity. And as an organization, we feel it's three-pronged. The first is, as I just mentioned, creating a workforce that reflects our community. And so the programs and opportunities that we can offer through Mercy College certainly help meet that need or help meet that goal. And then we believe that providing culturally appropriate care to meet the diverse needs of our patient population. And part of that, of course, is our language access services that we provide. And then finally, we believe that the cultural humility, which sometimes is interspersed with cultural competency, but we believe it's more of a lifelong career process as opposed to attending a class one day and one and done getting a certificate in how to treat patients of other cultures. And so ours is more mission related, and the work that we do in all aspects of our work, and being sensitive then to cultural differences in those areas. So that kind of leads us to our presentation, our focus topic today on the telehealth. Next slide, please. And we were excited back at the beginning of the coronavirus, first few cases that we had here in Central Iowa, to announce that the opportunity to provide services through telehealth means was available through Mercy. And here, maybe to give you kind of an introductory overview, is a news feature that KCCI did to announce our opportunity.
With the technology to practically park itself, this is the 2020 Ford Escape.
Yes, the coronavirus pandemic is forcing doctors to adapt fast. A new command center at Mercy One in downtown Des Moines can even control what happens here at their hospital in West Des Moines.
You are looking at photos of Mercy One's new command center inside the downtown hospital. Doctors sit at a computer station and make their hospital rounds electronically.
This pandemic has changed just about everything on how we're practicing medicine.
Dr. Joel Ward led this massive undertaking, putting the year-long project together in 2 weeks. The command center relies on these portable workstations, which a nurse moves into a patient's room.
We're going to bring in essentially a television monitor with a camera and a microphone and speakers connected. You're going to have your doctors on the monitor.
The goal is to minimize the number of people going into a hospital room and also conserve personal protective equipment.
Absolutely, this is revolutionizing medical care.
Obviously, if a doctor still needs to physically enter a room, they will. But this new system provides service at a safe distance.
We can show you labs. We can show you your chest x-ray. We can show you anything that you need to see or want to see right there at your bedside.
Hello, Maggie. How's it going today?
On the outpatient side, Mercy One is rapidly transitioning to telemedicine. 300 providers in more than 60 clinics are seeing patients on screen.
Today, I think I saw roughly 18 patients, and I think 13 of them were telehealth.
Dr. Tim McCoy is leading this charge. Today, he helped walk an 80-year-old patient through an online doctor's visit.
She doesn't want to sit in my waiting room and get exposed to anything. And so she loved it. She was like, this is the best thing ever.
In just the last 2 weeks, Mercy One has done more than 4,000 telehealth visits, keeping waiting rooms empty in an effort to flatten the curve.
Patients have needs. They still need to be seen. They still need their checkups, and they don't really want to come in. And if we can do it remotely, even better.
And doctors say some visits still require you to physically come in. So if you have any questions and you're interested in telemedicine, they say call your provider first and ask about your options. Reporting live in West Des Moines tonight, Laura Terrell, KCCI 8 News, Iowa's news leader.
Well, thank you. And so now moving right to the star of our video, and I like to call him our telehealth guru for Mercy One. Here is Dr. Joel Ward.
Thank you again, Jackie. That I was telling them before everyone joined, that was the first time I've seen that video. So I was looking and I thought, wow, so young back then. What happened? So I really like to give kind of a high level view of really what all of our services and are. We use the term telehealth, telemedicine. You may even hear the word virtual care a lot. And people wonder, what's the difference in all of them? Well, for us, they're all pretty interchangeable. Um, I don't want people to get confused that I've got a telehealth visit, but what about my telemedicine visit? They're really pretty much the same thing for all of us. Just all interchangeable. And surprisingly, a question that I get a lot is where did the idea of telehealth come around from? And in researching this, I don't know if anyone on is familiar with the cartoon The Jetsons. Way back in 1962, they actually had an episode where um, the son Leroy caught Venus virus, and a doc showed up on their TV, and that was the start of the idea of telemedicine right there. Um, we have a lot of different ways to do telemedicine. If you just opened up a Google search and you typed in telemedicine, telehealth, virtual care, you're going to come up with a whole lot of different companies that do it. And they offer a lot of different what we call telehealth platforms. Um, the biggest ones in the business are Amwell, Doc ASAP, Doctors Now. I mean, any of these offer good services, and they all do it in different ways. But fundamental to all of these is doing it with a smartphone, a tablet, a computer, a device that has a camera, a mic, and a speaker, so that you can see your doctor and your doctor can see you. And even sometimes just doing a phone call visit with your doctor or your nurse practitioner counts as telehealth, telemedicine. In fact, a lot of times we've done just a phone call just to check up on people to make sure that they're doing okay. The last year, 2019, there was only about 1 in 10 people wanting to do a telehealth visit with their doctor, which is really surprising to me because there's a whole lot of benefits to doing telemedicine. Well, now about 8 in 10 want to do a telemedicine visit, and it's not hard to understand why. COVID-19 really forced us into having to do this, and we had been working on telemedicine for about a year. It was a year-long project, but because of COVID-19, we really had to get it up and moving in really just a very short time. I like the phrase, "You've been given this mountain to prove that it can be moved," and I think that's a very apt saying for everything that we've had to do. Now, not just patients wanting to do this, 8 in 10 people want to do it. We're finding that it's about the same amount of doctors that want to do telemedicine visits also. About 77% of doctors want to do it on the last medical economics research that went out. And to me, it's really kind of a no-brainer. Why would a person want to do this? It's instead of planning your day around the doctor's appointment. For me, I have to take off the day of work. I've got a plan for how I'm going to get there. I can do it from home. I don't have to sit in the clinic waiting room. I can know specifically that I'm talking with my doctor, and it's pretty easy. Now there are quite a few limitations though, unfortunately. As a doctor back when I would see someone, I would always shake your hand. Now over the screen we can't do that. We've lost some of our human contact because of that. I can still look people in the eyes, but I can't shake your hand and greet you into the clinic. I can't really listen to your heart and lungs if you're doing it from home, and I can't really feel where it hurts. If you say my knee hurts or my elbow hurts, I can't really put my hands on you to help feel where it hurts. However, I can look at your feet to see if your feet are swelling. I can hear you cough, and I think the most important of it is that I can listen to you and I can hear what's going on with you. Now, there are times when a person can help your doctor, your nurse practitioner during a telehealth visit. Take your temperature with me. If you've got a home blood pressure cuff, take your blood pressure. If you've got a home oxygen level check, you can check your oxygen level. So if you do it right there with me, I can make sure that you're doing it correctly. We can both see what it is, and we can both talk about the results right there. Now, that video did say that there are times when we do have to do things in person. There are times when, you know, a healer's touch is needed. And of course, medical emergencies like chest pain, stroke, you know, if you're having left-sided chest pain, if you're noticed that you're starting to have a facial droop or you're not standing correctly, those are absolute emergencies. You have to get to the emergency department. There are other times when we're talking about a more complex condition that it's just easier to be doing it in person. But we're going to do everything that we can over telehealth. We've got a lot of our patients that are immunocompromised, meaning that their immune systems don't work very well, whether it's from active treatments like chemotherapy or medications like steroids, or even age, very young, very old. We don't want you sitting in our waiting rooms. We don't want you sitting in our waiting rooms, but sometimes that's unfortunately our best option because you require more advanced care. Now, we'll do everything we can via telehealth. Now, does anybody have any questions? I'd love for people to just say, hey, I've got a question.
I have lots of questions, Doctor.
Oh, awesome. I love questions.
So my name is Lata De Mello, as you can see, and I'm an advocate, also the assistant director of Monsoon. We serve victims of domestic violence, sexual assault, human trafficking, gender-related homicide in the Asian and Pacific Islander communities in Iowa. You talk about telehealth. I do know my niece is a clinical psychologist in California. She'd come to visit and she was doing telehealth all the time, which was great because I had her around. But my question is, I know y'all said interpretation and Jackie was talking about diversity. How does that work with people who are immigrants, refugees who don't speak English? Do you do, when you do an interpretation, is it a phone interpretation that's going on?
Yeah, we absolutely do interpretations. Absolutely, we do.
And sorry, and that's like a two-question thing.
Yeah.
What happens with people who don't have, and I know lots of immigrants and refugees who do not have access to technology, to a computer, I know they use smartphones all the time, to internet, etc. Okay, thank you.
So, which question would you like me to do first?
Both, or, as in whatever you think, because one, I'm assuming in my head, I'm imagining it is, the phone interpretation as our clients have had in the past, but how does it work? It's not simultaneous, it's, I guess you all share something, because I'm not sure with mental health therapy, how that works also. It's one thing having a GP do this, it's another thing with mental health discussion.
Yeah.
Dr. Ward, I might interject here that it's interesting you bring that up, Lata, because we actually, in our behavioral health area, had started doing, as you said, was it your niece that is the clinical psychologist? We had started doing, because we have many rural patients, we had started doing more, I don't know if they called it telehealth, but we had started doing remote services for behavioral health for those individuals who were, English was not their first language. Prior to COVID, we would actually have an interpreter on site with the psychologist so that they could see, the patient could see the interpreter. But as you know, with COVID, we want to reduce the risk of exposure. So they too then have started using not so much phone, but I think Dr. Ward is going to describe this too, where let's say a Zoom platform like we're on today, you can have an interpreter via Zoom, just like we're communicating today.
Oh, that's great.
Yeah.
That's good.
Sorry, Dr. Ward, when she
Thank
brought
you.
up the behavioral health, I thought I would interject that.
No, that's perfect, Jackie. And Lotta DeMello, it's very nice to meet you.
Nice to meet you too, doctor. My
Oh.
doctor is at Mercy, and I saw him in that video. I'm like, oh, that's the doctor. I lived in Des Moines for 17 years. I moved to Iowa City about 3 years ago, but I still have my connections there. So,
I think we're a good group of doctors here in Des Moines, but I'm biased.
yeah.
So yeah, we absolutely do offer interpreter services. And like Jackie was saying, we can connect via Zoom. The telehealth platform that we choose to use is Zoom, and it is not the same version as the regular customer gets. We have specific security in place beyond what most people have, to make sure that it is absolutely private, absolutely HIPAA compliant. Our interpreters can join. Our interpreters generally will not join with video unless we need like American Sign Language, where
Right.
they need to be seen.
Right.
That way we can, you know, we can respect patient privacy as much as possible. When a person needs to make an appointment, they can either directly call a clinic that they're familiar with, or they can go to our website, mercyone.org. We can search for providers based off the specialty they need by the provider. And then there's even a search box, and you can type in the language that you need on the search box. You can type in Spanish is our most commonly spoken language for our providers, and then it'll pop up and show you who speaks Spanish. Here soon, within this month, we are offering online scheduling also. So, of course, the website can be changed into multiple different languages, and then you can schedule your appointment that way. And then there's a section that we're building out that will let you identify if you need an interpreter for your doctor's visit also. So we're making it as easy as possible for anybody to schedule an appointment.
But what have you all, looked into, have you all had any barriers about patients being able to access technology, access even
Yeah, and unfortunately, that's the Achilles heel of telemedicine.
Right.
Is that unless you have readily accessible technology, it's not really available to you.
And lots of that is one focus. I mentioned I've got a lot of things going on in terms of health equity. And so I just about a week ago met with the 2021 Iowa legislative group that looks at some of these issues. And of course, telehealth has elevated to the top of something that the legislature is interested in. But along with that, and if you know Representative Roz Smith from Waterloo, do you know him?
Wonderful.
He is, and he is very concerned about this issue that you have raised about broadband access and access in communities of color, vulnerable populations, having access to technology, and will be working with us on legislation that will provide greater resources for access.
Okay, great.
So support him in whatever he's working on.
No, I do too. But one of the things, though, I do want to say, I was reading today about schools, how they have adjusted to COVID-19. One of these sites had different schools in different areas, but it was interesting that some of the school districts had with remote learning, in person, hybrid, and the difficulties then with the COVID going up and down, the surges. They also provided Chromebooks to kids, and some schools have seen such a boost in, because these kids were already, all of them are savvy about technology from the time they, I think, come out, even if they are in the womb, probably, because they are way ahead of me. So, but when they have done that, I thought, oh, that's a great idea. I wish more school districts, and of course, some of them also, by the time kids were away, did all the ventilation, the cleanup, the whatever it is that's required for the in physical spaces, which hospitals don't need. But I was wondering if hospitals were, if the legislature could say, hey, instead of spending money on defense and wars outside, let's save human beings here and provide them with the necessary equipment that can get this going, including technology. So they did say that a lot of, because of, thank goodness he's going, the FCC chairman, but the only thing he did was that could be beneficial to rural folks was being able to give them more access to technology than they previously would have. But that's because, you know, internet providers also saw some business over there. So it's good, Jackie, that they have more connections with rural folks. We have our immigrants, refugees, also rural areas. And frankly speaking, Iowa is being seen as rural, right, in many spaces. So that's a good thing. So anyway, I'm glad. I just wanted to know how you'll do the interpretation, and I know Mercy has been good for a long time with the interpretation.
One area of this too that we really want to get into is called remote patient monitoring.
Okay.
I see Dr. Cardenas. Hey, Dr. Cardenas, jump in anytime you want with me.
I was going to segue to him in a minute because I think it's a nice, Lata raises a good point about comfort level and so forth among our immigrant and refugee community. And Dr. Cardenas, in a conversation that I had with you a couple weeks ago, you shared some of the services. By the way, Dr. Cardenas is with our East Village clinic. So Dr. Ward and I are on site at the hospital. Dr. Cardenas is in a clinic. And what are some of the services that you think would be of interest to our immigrant community?
Well, Jackie, I'm Dr. Cardenas. I worked here at Mercy East Village. I've been working here for a while, and before that, I worked at Mercy Ottumwa in a rural clinic where there's a huge underserved community in Southeast Iowa. But as we discussed that day, Jackie, I believe that the lack of patients knowing where we're at and what can we offer them, you know, like most people don't know I exist here, so that's tough, and that's why we're trying to market over here. As Dr. Ward was saying and what you guys were discussing, the lack of access, you know. The other day I had a patient that was Hispanic, of course, since I speak Spanish, but he unfortunately did not have a smartphone. You know, he's a 50-year-old immigrant with a construction worker, and he said, well, we can do a telehealth visit because he had symptoms of COVID, and he said, I don't even know what that is, you know. So education towards this patients about how we can serve them in their own language or access to that technology, I think, is our biggest issue right now, which is what we were discussing. But again, our clinic has two Spanish-speaking providers, and me and Dr. Abels, and we're open for business. But I think that me being Hispanic, word of mouth is the best thing that we can do. And I've been seeing more and more patients, but the lack of them knowing what we do or where we're at or who we are. And of course, COVID didn't help at all, you know. That took a huge hit on our patient population. But I'm also surrounded by several clinics that have the same services that I provide. So sometimes it's kind of tough to get them in here. I think that them knowing how can I put myself out there, because we really do everything, you know. And once they get to know us and what we can do for them, the lab is here, procedures can be done here, et cetera, et cetera. And once COVID disappears, if it ever, then we can have, you know, back the urgent care, although that might not be bilingual, but they still have small emergencies. It's just having access to them.
Dr. Cardenas, one thing, and you might have been with the patient then, I mentioned that Mercy received an anonymous donation to provide influenza vaccinations, particularly to the underserved populations. And actually, this organization, the Refugee and Immigrant of Central Iowa, was our partner in sharing the word about it. However, I did notice, even though, you know, we did have some good participation, and it was a free flu shot, basically, that there is misinformation and, to be quite honest, mistrust right now about what we are doing in healthcare. What kind of things do you see, Dr. Cardenas? You mentioned patients knowing where you are, and you're located east side of Des Moines. And what kind of things can we do better to really eliminate some of the concern and maybe the mistrust that people have about healthcare right now?
I believe that we need to get them through the door. Unfortunately, Hispanics, Hispanics, just like, you know, just like Americans, both white and black America, if you want to put it like that, African Americans and white or Caucasians, you know. I had a patient the other day. He said, "No, I don't want to get the COVID vaccine, but it's available because they're going to chip me, right? So they're going to track me and everything that I do." And I just laughed and I said, "They already do that, man. Like, they have everything. You don't have to worry about it anymore, you know." But I think that with Hispanics, with their lack of knowledge, the only way is like having the vacuum cleaner guy coming to your door and showing you the product. You know, I tell them, "Hey, it's the flu. It's not the common cold." You know, they think that they're going to get the flu and then they're sick all the time. And you know, it's just that misconception about the vaccines that is so tough for these immigrants, because they are not in Mexico or Guatemala or Honduras or all the Latin American countries. They're not used to this. You know, it's not the prevention system that we have over here. Even for colonoscopies, you explain them a colonoscopy and you still have my Mexican patients saying like, "Oh no, that's the back door, nothing goes," and you're like, "Come on, man. It's not how it works. It's the prevention of it, you know." And unless you're a good salesman with them, it's really hard to get them to understand what you're trying to do and what the product is all about. You know, we can have all the products and the prevention that we can have, but if they don't understand it, it's kind of like a tug and pull, you know, where you're trying to sell a product that they don't want to have because they've never had before, and they think that it's going to cause them cancer or the disease or something. It's just more information in their language and really trying to be a good salesman with a underserved, again, in my case, the Hispanic community. You know, I think that that's really the biggest thing. If they don't get to see me or to see a provider that speaks their language, it's a very tough sale. You're going to have a really hard sale, even of a church or even of a congregation, or, you know, it's just going to be a tough sale because they don't believe in it. Because they don't understand what it is. Again, they think it's a cold, that they're going to get the cold. That the cold is not, you know, and it's not the same thing, and they don't get that part.
Dr. Cardenas, I wanted to say something here about, I know you said, I know clients also of mine who do not want to go to doctors and all. But one of the things I also do understand is because they talk about the kind of food they eat, the, you know, air they breathe, the things they do over here that brings a lifestyle of creating different kinds of illnesses, which they were not used to. I mean, I come from India, we used to different kind of diseases, different kind of illnesses. No one cared about flu and cold because that was considered, well, that's part of growing up. You get your vaccinations when you're little because that's what people did. Even in rural areas, go to the medical center. But beyond that, you know, when you get sick, or the doctor at the corner would give you, the local doctor, various colored pills, and you were okay. So that's why I think with the Asian Pacific Islanders I work with, there's been reluctance also about that. Except those who have, it's very interesting because it spreads in the community. If you have Medicaid, then you can get anything done. So it's all free medicine here till they realize that it's not quite so. So that becomes also different ways of how we address it with the people we serve. I work with victims of domestic violence, sexual assault in the Asian Pacific Islander community. I want to, unless someone has, I know Paula, hello Paula, who's hiding, has sent a question, but I do have a couple more questions about, how the medical field, like Jackie mentioned with the Representative Rass, but also about how we can work together on certain issues that are important to immigrants, refugees, and mine is mainly Pacific Islanders who do not have access to Medicaid.
Can I just to make sure that we get this onto the recording for those watching on the website? Paula had asked a question about what's the app that people will need to use to be able to communicate with the medical staff at Mercy electronically. And Dr. Joel's or Dr. Ward's response was the Zoom app. And then Paula, just really quick, had also made another note that just came in that about the need to educate high school students about the app so that they could help their parents, or that they have this when they move out as well. Many parents of her students don't know how to use Zoom for the parent meetings either. So just another note. And then Lata,
Paula also said that she might have missed, she was not familiar with Dr. Cardenas. And we want to just say again that he is a physician at our East Village Clinic, which Dr. Cardenas is located on. I always forget, are you located on?
It's on Des Moines Street. It's 110 Des Moines Street. So it's really close to the Capitol. It's next to DMAC here in downtown. So yeah.
Some of you may remember that the clinic that we had there previously, remember that was across from Des Moines General. Yes. They're in that same site. Paula, do you remember that?
It's near La Tapatia.
It's yes. It's
a
block away.
Yeah.
I'm a frequent flyer there. Yeah.
Yes. It's a great store.
Well, Paula and family have been around, and so I think she knows that area. I just wanted to make sure she got that.
So I wanted to ask how, I'm sure you'll have patients who are from the Pacific Islander community, and Dr. Cardenas, you spoke about Atamwa and, meatpacking plants, and then there are some there and they don't have access to Medicaid, so they have to rely on Affordable Care Act, whatever else the company they're working at is offering. We are working on a sort of movement campaign to get them Medicaid. My question and my urging also to you all is, would you all be willing to be part of that movement? Because that's what we want to get hospital CEOs or hospital authorities to be pushing legislators to get this passed. It's not easy because it's been years since that effort has gone on. And our current, and it's of course the US senators that would be important to that change, but our current US senators are not really interested. So would you all be willing to, because this is for immigrants, refugees, but it's also for Pacific Islanders who are neither, but who are still considered as migrants of sorts.
Lata, do you have that in writing, information about this legislation?
I do. I will, Jackie, Jackie, something for you to be attend, meetings, and then that might start a good process for you. That would be great. Thank you.
Okay, thanks, Lata. Yeah, if we could, we've got about 9 minutes left. Do we have any more questions from anybody attending around telehealth, or any questions that Dr. Ward or Dr. Cardenas can answer, or Jackie can answer from Mercy.
I wanted to point out that now that we are looking to the vaccination, I know this isn't specific to telehealth, but I think it's important, again, as we go back to the education, and I think Paula brought up, a good point about in some of our refugee and immigrant communities, it's our young people, that are providing this education to their families, that we want to help people understand how the vaccination, the coronavirus vaccination is going to be important. And that's probably a whole different, we'll have to have a come back, Stephanie. You'll have to invite us back and talk about how the vaccination will be administered. But my point today is we want to begin to create a safe opportunity for people to ask us questions, particularly from the refugee immigrant communities, so that they can feel, because we know that because of all the misinformation and sometimes the sourcing where it comes from, that they don't know who to trust and who to believe in the community. So we want to begin to provide that opportunity through education and awareness of all of these issues, but particularly as we go into the vaccination stage for the coronavirus. And Dr. Cardenas's location actually was doing, are you still doing COVID testing, Dr. Cardenas, at your Fury Clinic?
Correct. Yeah, we're still using, we have a Fury Clinic for adults and we have a Fury Clinic for pediatrics. So yeah, and then half of our clinic is for healthy patients. So we don't see any COVID, although once in a while one of them goes through, but it's not common. But yeah, I think that's something that you were mentioning, Jackie. Going back to my Ottumwa days, they had a group of people. It was mostly Hispanics and Southeast Asians, Vietnamese, Laos, Thai, and they would get them together at the Y over there. Of course, there has to be an incentive, so these people will get, I don't know, some type of food, I think, some type of dinner. And during those things, we would present cases, of a flu or how to get access to them. So, but this was backed up by the university, by the Iowa State University. So there was a program with Iowa State University as an outreach program in Ottumwa. So maybe something like that can be backed by the state or by, Mercy, so forth, where people are like, okay, well, they're not, this is good companies or good, healthcare organizations behind them. Might be a way to, if we incentivize them to, if you come to this 10 meetings, you're going to get a $20 gift card. And again, I don't know, because I don't know where that money's going to come from, but at least I guess we can get access to all these people and we can get them together and kind of explain what we do and what we can help them with.
Monsoon, the organization that I work with provides that information to people. I do want to say, I know quickly, this is just my own comment and opinion about how the COVID vaccine is seen in this country. I come from India, so and because Monsoon, the organization I work with, thinks transnationally, it really galls me that this country, the people have taken it so lightly, not taking, and immigrants and refugees actually take a lot more care about coronavirus than I've seen with other people who feel entitled not to wear a mask, don't have to keep social distancing, no following guidelines, but get first dibs on the vaccine. I'm like, really? This is what equity and justice and fairness around the world is. So Jackie, that was just for something that I wanted to mention here. It galls me. It really does, because of the whole, and I'm one of those who really is also thinks of the medical industrial complex as something that actually is not beneficial to our communities, and how we can address it in a way that is fair and just for everyone is really important. But I know Paula had something to ask or say.
Yes, I read Paula's question, and I don't think, Paula, that we have, and I don't want to be a purveyor of misinformation. Maybe Dr. Ward or Dr. Cardenas know this. I am not sure yet whether the plan to disseminate the vaccination has included definitely that the vaccination will be free. Dr. Ward or Dr. Cardenas, from your information, have you seen or read anything to say that yet?
I'm not familiar with anything.
Yeah, as you know, Paula, that the two companies that have submitted, Pfizer and Moderna, received quite a bit of funding. They received quite a bit of assistance to be able to, kind of elevate and escalate their research. And so based on the fact that they were kind of fronted, so to speak, money, some of the sessions that I have attended led me to believe that the goal is that they make it accessible to us, when the vaccination is approved. But again, I don't want to, say that for sure. But I do understand that because they both received quite a bit of private money, there was the intent that they were able to do the research necessary, conduct clinical trials in a speedier manner, with the intent that the vaccination would be accessible to the public.
And we've
But
been
again,
working.
Stephanie can have us back in a month and we'll have better information.
Yeah, we will be, as soon as we have more information about that. I was just going to say, we're working with Iowa Department of Public Health, Polk County Health Department, and healthcare providers, just in terms of being able to get updates and critical information out to our communities. And as soon as we have any updated information from anyone, that will definitely be going out in Rossi newsletters. And as soon as there's more definitive plans around that vaccination, and the distribution of it, we would love to have a specific, we will be having a specific webinar around that, to be able to get information out. And yeah, we'd love to have you guys back. And
the test, and we are close to one. And the test is free as far as I know at Test Iowa. I'm not sure.
Yeah.
Paula,
well, I have heard that if you don't have your doctor's authorization, you may be charged. Am I correct, Dr. Cardenas?
I got free tests. My co-workers got free tests. You have to go online and get an appointment, and it's all free.
You need to apply online and get the testing performed. For Test Iowa, the problem is that the amount of tests are not there, or that not everybody is a candidate. I remember when they started it, I was not a candidate. So it all depends. I don't know if it's changed, but yeah, it was free, and it was free until last week, I believe. Not Mercy, I guess, not a Unity Point, but that's a different story.
Paul, it's one I really quick wanted to throw. Paula had just sent a question in about where she can find a one-pager, a multilingual one-pager about COVID prevention and symptoms. Paula, we have something that Polk County had put out about the differences as well between allergies, flu, and COVID for this flu season. We can connect offline afterwards, and I'll make sure that you get that. And it is available in 9 languages, I believe. Dr. Cardenas, I did not mean to cut you off. I just wanted to get that in there too really quick before we hit 1.
Yeah, sure.
Are there any other additional questions? And Adriana had put in an additional comment. Sorry for the confusion. However, the COVID test is not free at our location, just to make sure that was included. Okay, any other questions or comments before we conclude? I know that afterwards, if anybody has questions or are wanting to connect with Jackie or Dr. Ward or Dr. Cardenas, you're welcome to reach out to us, and we're happy to connect. Again, this webinar is going to be available on the Rossi website, and that will be available for community members to be able to access for free at any time moving forward. any other questions or comments before we conclude? I just really wanted to quickly say thank you as well to all of our participants and all of our guest speakers today. Again, we just are so grateful for your time and your expertise and sharing your resources and knowledge with us. Thank you so much for being here and for all that you're doing to help keep our community safe and healthy.
Thank you.
Thank you.
Thank you, Stephanie, for having this series that I think will be very beneficial for our community.
Yes.
Sure. Thank you all.
Thank you.